Welcome to Breaking Point, a podcast from CAPC, the Center to Advance Palliative Care. In this limited series podcast, CAPC invites healthcare workers from across the country to share their eye-opening stories from the front lines of the pandemic. Listen as they give us an unfiltered look at their reactions to the demands they've encountered and the coping strategies they've employed as they reach their breaking point. Your host today is Dr. Andrew Esch.
Hi, everyone. I'm Andrew Esch. Thank you for joining us this week on Breaking Point. Today, we're joined by Patty Fogelman, who's the Director of Palliative Medicine Program at the Guthrie Clinic, which is based in Corning, New York, and Sayre, Pennsylvania. Patty, thanks for joining us today, and it's great to talk to you.
Thanks for having me. This is exciting.
Yeah, you bet. We spoke a couple of weeks ago. We were talking about doing a blog together and things like that. And at that time, you gave us a glimpse of what the experience has been like being a frontline clinician at Guthrie during the pandemic. And I was wondering if you might just go into a bit more detail about what it's been like for you in your role on the front line.
So we are an integrated rural health system here, as you know, in northern PA and then the southern tier of New York. And so we have a really wide range of patient area, service area that we cover, but lower kind of population density. So we get patients that may be several hours away, often very removed from the healthcare systems or kind of in these deserts of care, where they may be going quite a distance to just get routine care. And so the combined result of the patient population we see are often people who may not have a lot of healthcare savvy, like maybe you would see those more in urban settings, versus patients who also may have some relative distrust or unfamiliarity with healthcare. And so there's been a lot of utilization from our perspective as a team to kind of come forward to kind of help these patients navigate, this path, and their families and their caregivers, to kind of help explain the technical lingo that they're hearing, from the clinicians at the bedside, or that they're reading in their patients and their loved ones' charts, because we have open chart now through the EMR. And so I think that our role has really become really forward in its advocacy, but also in kind of that education outreach piece. We've also kind of had a really nice opportunity to engage with our staff, our colleagues, I think in a more meaningful way. It's more than just kind of showing up to do a consult. Now we may be coming in to see a consult, but we're also, talking and dialoguing with our teams and our coworkers and our colleagues, and having conversations that sometimes in just the span of 2 to 3 minutes are supportive in nature and provide that boost of support or morale that you need to kind of keep going through your day. And I think likewise, they do the same for us. Sometimes it's really hard to see a lot of the same thing over and over. And so when you can kind of rely on each other and have this, support, I can tell you the MDT approach here has been marvelous. Our engagement in the ICU, from my perspective with my team, is we implemented a joint rounding model. So we round with the critical care team in the ICU, and that rounding team includes the ICU social worker, plus the respiratory therapist, plus PT, OT if they're there, as well as the patient's nurse. And I think this is really gives credence to letting everyone have a voice at the bedside. And we just shifted that model a little bit now to say, let's start rounding during visiting hours so that we can try and capture that time at the bedside with our patient's family members so that they're part of rounds with us as well. And that was kind of a suggestion that our team put forward. So I think, from a patient care perspective, you're seeing this integration in a way that hadn't been there before.
So even in the best of times, that's a pretty tough patient population you have, given the geographic spread and the things you described. What's it been like for your team emotionally, and you personally emotionally? Like, I'm sure you're dealing with increased volumes and staffing shortages and people out in FMLA and all the things that we're hearing about going across the country. Like, what's been the impact of that emotionally on you and the team?
So I wish I could tell you it was all sunshine and roses, that, we're doing marvelous. We're really doing great with our coping skills. But the truth is that the work is hard. And with how divisive this medical pandemic has become, in the global sense and at the level of national, politics and people, it's become sometimes these situations that just feel really antagonistic. And I think that wears down on people. And so one of the things I did really early was to kind of start focusing on team wellness. And so at our daily IDT, we set aside, 5 to 10 minutes to kind of just talk about the team health. What are the team's dynamics? What's everyone going through? We kind of do a quick little gratitude exercise we've been doing these last few months to say, what are the 2 things we're really grateful for today? And how was everyone's day yesterday? And we're checking in with each other. We have a group text. And so we check in with each other really frequently through the day. And sometimes, it's just to say, how are you doing? I see that there's 2 new consults in the ICU. Do you need help? Sometimes it's to say, hey, I'm done early and my work is done. What can I do to help you? Or how can I reduce your burden? And so, we've been able to kind of maintain, I think, a really important human connection through a time where care has become so technical, and the amount and the intensity of therapies that we're delivering are really top notch, really high tech. But to kind of bring this human capacity forward and say, this emotional connection, the human connection, and the human story itself matters, right? So we've done some things, which I think as much for our team as much for our patients, like putting in the get to know me posters in all of our ICU rooms so that we're engaging with family members and saying, please tell me about your loved one. And I think from the palliative end, we like the human story. We have a curiosity about the human condition. And I think that drives a lot of the work that we do in palliative medicine. And so when we bring that forward and we're able to kind of carry that out in these different ways, that helps kind of improve our connection. But then it also helps us to help the teams improve their connection to the patient. So, if we find out information from our family meetings, we can pass that along to the teams and to the bedside nurses so that in the process of caring for the patient, you can reference these things and talk to them about what may be familiar, and you're kind of helping to perhaps reduce their delirium or help reduce their anxiety. So I think it's been very important to kind of maintain these check-in points, to focus on wellness, to have time every day to kind of say, what am I grateful for today? We've done a couple of times a week some meditation exercises. There's several apps that are out there, so depends on the team member. I personally like the COVID coach app that the VA developed, but my one coworker really likes honest meditation, which you can set the level of saltiness that you want in the meditation itself. I mean, it is humorous, but I'm just kind of like, yeah, I need something a little more soothing. But everyone's kind of got their way. And I think we've also been very protective of each other. So if one person doesn't feel well, we're closing in ranks. We're letting that person go home. We're not compelling anyone to stay and push through their day, go home, get rest. What do you need? How can I help you? And, I think that supportiveness and that very quick willingness to kind of say, what do you need? How can we help you? Has created in our team, at least, a strengthening of our dynamics with each other and for each other. And that connection we feel has really only deepened. We're a small team, but we think we're a pretty mighty team. And I think our impact over the last 2 years within COVID has really been demonstrated.
That's great. The connectivity you talked about is so important. And I think that goes both ways. The patients certainly need it, but you're right. Palliative care providers need it as well. And with volumes up, like what you just described, volumes being up and all that, and being more integrated into the care of patients since the pandemic started, it's created more strain on teams too, right? Like your consult volumes are up. You maybe don't have as much time for that connectivity. I'm just wondering if, even though you've bonded together, are you experiencing burnout, or
I think we
lost people?
So we have been very fortunate that we have not lost people, but we have seen the loss of other staff on some other teams. And, I think it's always devastating because you see the effects it has on the people that are left behind, so to speak. But we definitely have had moments of burnout. And, it's been really interesting because I will have members of my team come to me and say, I'm worried about so-and-so because they seem like they're really burning out. And so that's a quick turning point to kind of say, okay, right now it's a small team, it's 3 providers. So we do 2 weeks of COVID rotation at a time, but our third provider is new and onboarding. So it's just really 2 people doing COVID. But when you hear from someone like, I think so-and-so is getting real tired, or it's been a really intense week in the unit, and sometimes that's my social worker telling me, sometimes it's maybe an ICU colleague telling me, we're quick to switch, and we're quick to say, hey, you've had enough COVID ICU, you're on like day 9 of 14, I'm going to take over today. And, maybe we can trade off early in a couple of weeks. And just as reverse has been, my team coming to me and saying, you've got a really full day with some of these administrative meetings. We've divided up the work in the unit, so you don't have to be as rushed, to try and do that. We are trying to make it a point, though, I have to tell you, like really simple human things, like sit down and have lunch together once a week. We used to be able to do that, I think, with a lot more frequency pre-COVID, but now we've had to work at it a little harder. We're not able to do the, once a month kind of go out after work team bonding type of stuff. I think that's just become a little more difficult for everyone to do right now, but we have found that making that time to have lunch together, and sometimes, we'll order lunch in, sometimes we're just bringing in our lunch, but we use one of our conference rooms. Everyone is very safely spaced. And it just kind of enables that sense of community to be reinforced, because sometimes we'll also use that time, to vent about a difficult situation, or to even seek advice. Hey, I've got this family meeting coming up and here are the dynamics. Can you help me? What do you think? Or how do you think I should approach it? Or, I did XYZ, but maybe that wasn't the right way to approach it. What do you guys think? And honestly, it's been a lot of creative problem solving. I think in rural health, though, number one approach to most things is that the problem's going to take a little bit of creativity to be solved, because our resourcing and availability is just different, in rural health. So we take that all kind of into combination, and we become, I think, a team that is not just friends, but really respected colleagues. And we're very, very quick now to kind of say, hey, I need help. Can you help me? Instead of trying to shoulder the burden by ourselves and push through. And, that's harder for some folks than others. Some have just been used to being lone rangers. But, the issue of burnout and moral fatigue and compassion fatigue is really very, very valid, and it's very, very real. And as we see it kind of unfold in different arenas and different departments, I think we've become more acutely aware of how we don't want that to happen to this team. So now we're investing, in our emotional health. And I will tell you, like, I very much use, CAPC's COVID-19 resources. So I take the emotional PPE section and divvy that out to anybody who asks for recommendations and advice. And so one of the things we did for our ICU team was to start these debrief sessions, because the ICU teams are struggling. And those debrief sessions are, initially, I think it was mostly like staff coming, but housekeeping shows up sometimes, the dietary folks show up sometimes, the food service people are welcome. So it's really just anyone who, for whatever reason, has to come into the ICUs. If you're affected by this work or the situation, or just the overall nature of being in healthcare today, come to the debrief sessions. And we co-sponsor these with our chaplain, with our spiritual care team. And it's been really good to just kind of have that space, say how, and again, to kind of reach out and connect with the other folks in this organization. Like, how are you doing? What do you need? What's the support that we can give you today? And how can we help you? And sometimes it's really simple stuff, like, I just need to find a way to let out some steam and to relax. Or sometimes it's just, I feel very overwhelmed or lost. And we also, as an aside, reinitiated the pause with our chaplaincy. And that has been profound, the impact that has had, with our teams, both from our perspective as a palliative medicine team, but also from the perspective of like the nursing teams, respiratory therapy, et cetera, just have this collective moment, with our chaplain, to kind of remember the sacredness of the work we do, the sacredness of the lives we serve, the families we care for. And I think that these are all ways we've continued to work hard to maintain human connection. Because at the end of the day, I think my personal philosophy is, yes, I come into work with an intent to reduce human suffering in whatever capacity I can. But that capacity to reduce human suffering includes looking after not just my patients, not just their families, but my tribe of people, and then the greater tribe of this organization, and kind of how can I have that in service to others become like a true philosophy, of the work we're doing.
I love the inclusion of the unsung heroes in all this, the support staff at the hospitals, right?
Absolutely.
Like when we go into medicine, we're sort of like, it's a known, like we're going to see some awful stuff, right? Like we that was part of the deal, but for them it wasn't. And to live through what they're seeing is really, it's profound that you've involved them. I
and
love
even
that.
Just, Andy, I always say, like, even, our new learners coming into these situations. So new graduate nurses, new graduate residents, like for first years in practice, this is not what people expected to be doing year one. They're as green can be. And there's just so much intensity. So I think that, you don't want people leaving the field. You don't want our future of medicine and healthcare to leave this field, to depart this field, because it was just so much overwhelmingness, right? I think that there's more we can all do as mid-level or senior providers, with our mid-career or senior level experience, to kind of say, like anything else, things do get better in time. Experience matters. Let me support you through this time and this process. But you can't let people feel alone. I think the worst thing we can do is kind of hear from someone who's suffering, who has the courage to come forward and say, I'm struggling, I'm overwhelmed because XYZ, and then kind of say, well, here's a number to call the employee assistance program. That's not enough. Take the 5 minutes to establish a human connection. We're all pressed for time. I don't deny that, but I think that, if it was me, I would hope someone would give me 5 minutes if I needed it. And I think that when I reflect back on my life, when I needed 5 minutes for various points along the way, there was always someone there, willing to kind of stop what they were doing and listen to me and to hear me, and not to fix my situation, but to just let me be heard. And I think that's just so important. And I think that's a tone we set as leaders. I think that's a tone we can set, with each other as colleagues and clinicians. But I think that's a tone we set also from an organizational perspective.
Yeah, I think that's so important. Have you or your team been put in that position to sort of mentor some of the younger folks, or give them the 5 minutes you talk to?
100%. I mean, I've recently had, one of our newer volunteer staff, whose offices are just around the corner from mine, just kind of swing by and say, it was on this pretense of, can I ask you a question? I never really understood what palliative medicine is, which kind of quickly turned into, I wanted to be a volunteer. I'm retired now. I was planning on becoming a volunteer, and now I feel kind of overwhelmed, and I'm not sure this is right for me. This isn't what I thought it would be. And so we kind of talked through that. And, another time it was a very young ICU nurse, great nurse, fantastic. Like the kind of nurse you look at today and say, if I could have done all this at 24, I'd have been phenomenal. Like, she's going to be great as she moves on in her career. But she very openly was like, I'm struggling. I have a lot of good things going on in my life. It's not about, life at home isn't happy. Like really, really good things are happening, but I'm just so overwhelmed by this time. This isn't what I thought my introduction to nursing as a career would be like. And so giving her that space and like, here's my cell phone, and call if you need, and text me if you just need like some bolstering, and reach out and don't hesitate, and kind of being that supportive person. And my nurse practitioner, found a painting that, just really moved her. And it was just one of kind of just like it conveyed kind of the importance of support and love to others. And so she purchased it, had it framed and donated it to our intensive care unit. So now when you walk into the ICU, right there, I mean, it's a substantial size. And, you know, they even added a little plate to kind of say, don't, you know, gift from so-and-so, the palliative medicine team. And, you know, it's really good to see these acts of kindness, you know, take root and take hold and grow. And I think that, you know, if we can be the first seed of kindness, it just keeps rippling out, right? It'll just keep growing. And so we're each trying to kind of implement that into our practices and kind of say, how can I help you?
You know, just before our time wraps up, I guess I just wondering, in addition to your source of joy and comfort you got from your team and taking care of each other, I'm wondering if there's one piece of advice or something that you've done in your little program that you'd share with others who might be listening that they might be able to do with their organization to try to make this time a little bit better. And maybe you've already touched on it, but I just want to give you.
So I think there's actually like a couple of things I would suggest. I think definitely making time to meet as a team at least once a week, whether it's for lunch or if you're able to, you know, get out after work and maybe go out for a quick drink or dinner, like whatever that dynamic is for your team that works to kind of capitalize on that. I think the second piece, which is really important, is to take stock of your own reserves and kind of just say, you know, what do I have the capacity to give and to do, and where can I bolster my own reserves? And, you know, I tell anyone who asks me, like, I'm really lucky. I have, you know, a loving husband at home who's retired now, and, you know, who as a result can then kind of flourish all this attention on me when I come home. And that's been very, very comforting in this time. But I also kind of view home as my retreat, right? So when I go home, this is my space. And even though it's cold right now and it's the winter, sometimes I go and sit on the deck for a few minutes when I get home because it's really crisp, really fresh air. And I've been wearing a mask all day, you know, or I was in the COVID unit under several masks for several hours today. And so you just kind of want to sit in this environment. And I think that, you know, our connection to our world is significant. How we look for those connections, where we find solace and peace in those connections are plentiful. We just have to look for them and see, where is their meaning for me? You know, so that could be those few minutes on the deck are meaning for me. I think connecting with, you know, younger nurses and hearing where they need some support is another form of connection. I think recognizing when a team member is struggling or needs some help is another level. And just as recently, I had a team member who was struggling for different reasons, you know, something more on the, you know, kind of resources and support from an office and clinic perspective, but being able to kind of give them that space to be heard and to talk through some possible solutions. And I think that as leaders, you know, as department directors, as leaders in this field, you have to kind of be constantly learning how to be helpful and how to creatively problem solve. So using the resources and taking the education that's available to us to kind of say, how can I do better? Right? Because we're all here in service to others. And I think we have to really internalize that first. If you view it as just a job, it's probably not going to be something you can stick with for a duration of time. But even though this has been, honestly, from a medical perspective and a practice perspective, the hardest 2 years of a 26-year career in medicine for me, this has also equally been 2 of the most meaningful years with what I would consider the greatest professional reward of feeling like my work is sacred and I come in here every day and I really achieve a goal with my aim to reduce human suffering. And sometimes it's just, you know, I make a patient laugh, or I improve their pain, or, you know, I've made your breathlessness better. And sometimes it's really that the support I can provide your family, you know, and your caregivers has been where I made the most impact. And so I think getting back to the core of what matters to our work, getting back to the heart of the matter is what allows us to kind of come forward in our practice and our acts.
Well, I want to thank you so much. And I love at the end, you talked about the meaning of the work having a greater importance these last 2 years, because in palliative care, it's always been more than just a job, right? You don't
Absolutely.
You don't come into this if you're not called to it in some way or have a story that's brought you to us. So,
and no one comes to palliative medicine to be rich either, right? Just for the record. Yeah, just so I'm super clear. Like this is work that we're doing because it has meaning. And at the end of the day, you know, my mom always said, she was an operating room nurse for 46 years. And my brother and I both went into medicine. And every time we said, I don't know where to go, or I don't know if I should take this job offer, and I don't know if this opportunity is a good one, her answer every time was, go where you're going to be doing the most good, because that's ultimately where you'll be the most satisfied with your work. And this is a woman who honestly lived her life in service to others, whether it was to us as her children, to her family, to her friends. And I think that's been like hitting home more and more. You know, the older I get, the more valuable I feel like that lesson has become. But you know, when you come here and you do this work, it's really like, we're here because we're doing the most good we could do for people and families and our staff and our friends and our colleagues. And that's the intent. So.
Awesome. Well, thank you so much for your time today. And Patty, the next time we chat, it's going to be in person with a drink in our hand. All right.
100%. I cannot wait.
Okay.
Yeah.
All right.
And if any of you guys are ever in PA, you know, North Central, up in the sticks of PA, come visit. It would be great to see.
Perfect. Get some of that crisp air.
Right, exactly. Beautiful.
Thanks so
here.
much.
Thanks, everyone.
Thank you for listening today. For debriefings, the emotional PPE toolkit, and more, visit capc.org/COVID-19.